The House Health Policy Committee will come to order. Will the clerk please take attendance?
Chair VanderWall.
Present.
Representatives Thompson.
Here.
Meerman.
Here.
Tisdale.
Here.
Bierlein. DeBoer.
Here.
Prestin.
Here.
Schmaltz.
Here.
St. Germain.
Here.
Bonak.
Here.
Frisbie.
Here.
Whitsett. Carter. Whitwer.
Here.
Neely.
Here.
Hoskins.
Here.
Foreman. Mr. Chair, you have 13 members present. You do have a quorum.
Thank you, Madam Clerk. Motion. Representative St. Germain moves to adopt the minutes of the September 3 meeting. There being no objections, the motion passes. Today we are going to be taking up testimony on House Bills 4108, 4107, 4847, 4402, and 4841. I do want to stand corrected. When the agenda was sent out, we inadvertently forgot 4107 from Rep. Harris, and that will be added to the agenda so everybody knows. We also have a special day taking place here in health policy. And we have,
She's in J-Car right now.
well, she left me. Well, gosh, Representative Carter's birthday. So when she comes back, we will make sure that we all let her know that we know it's her birthday. So, you know, we will talk about that when she gets back. So I appreciate that. So first up, we're going to hear testimony on my own bill. It's House Bill 4402. The committee will go at ease.
The House Health Policy will come to order. Representative, the floor is yours.
Well, thank you, Madam Chair, and thank you, committee members. The bill before us today would add testing for cytomegalovirus to the list of diseases screened for at birth. CMV affects 1 out of every 150 babies born, and about 1/5 of those develop lifelong health problems. CMV is a major cause of hearing loss, vision loss, intellectual disability, impaired motor functions, and seizures. More people will have disabilities due to CMV than Down syndrome, fetal alcohol syndrome, spina bifida, and pediatric HIV. The most pressing part of CMV is that 90% of the children born with it appear to be healthy at birth. Many of the symptoms don't start to appear for several years, making it hard to diagnose early unless specifically tested for. Across the U.S. is no standard of care or routine protocols regarding screening of newborns for CMV at birth. But it can be tested through saliva, urine, or blood using a basic PCR test. If it's caught, however, it can be treated, with most effective results happening if the baby is treated before they are a month old. Simply put, we can save lives by testing our kids for this dangerous virus. My bill 4402 would add CMV to the list of conditions already screened for at birth, which includes sickle cell and a few others. It does not add significant new burden, as CMV can be tested for using the same specimen as most of these other diseases. The bill also requires that the department create informational material that can be given to doctors and patients to raise awareness of the disease and its dangers. Thank you for your consideration, and I'm happy to answer any questions if you have them.
Representative Bonak.
Thank you for your testimony on this. Really, I was unaware of this virus. Can you answer the question, Is Michigan a Johnny-come-lately when it comes to testing for this? How many other states do you know of that do test at birth?
That is a great question, and I know I have a couple experts that are going to be stepping up shortly after me, and I would defer that question to them so I don't misquote that.
Members, do we have any other questions? Okay. All right. Thank you, Representative, for your testimony.
Thank you,
And
Madam Chair.
The committee will go at ease.
The House Health Policy Committee will come back to order. We have a few more people that wish to testify on House Bill 4402. I'm going to read a couple questions or cards, and wishing to speak in support of the bill, Dr. Charles Conrad, Michigan Audiology. Oh, Chelsea, I'm sorry. My bad. I apologize.
I have to work on my penmanship, I think.
Well, let me tell you, I should be able to read it because mine is terrible, and most people in here know that, so I apologize. The testimony table is yours, and thank you for being here.
Thank you. Good morning, Chair VanderWall and committee members. I am delighted to be here to support HB 4402, which will bring universal screening for congenital cytomegalovirus to babies born in the state of Michigan. I'm Dr. Chelsea Conrad at a large health system in Metro Detroit. I'm here today on behalf of the Michigan Audiology Coalition, which represents licensed audiologists around the state of Michigan. Our profession identifies and treats hearing loss and balance disorders in patients of all ages. As you've heard, cytomegalovirus can have very devastating effects. It is a common virus of the herpes family. Many people will become infected with this in their lifetime with symptoms similar to a common cold. However, it is most impactful to women that become infected with it during their pregnancy. You have heard of some of the very serious consequences of infection, including hearing loss. However, most women of childbearing potential have not heard of CCMV, nor do most healthcare providers routinely screen for it. And again, the alarm of this disease is that most babies are going to appear completely normal, completely healthy at birth, and it can take 2 or more years for many of the side effects to manifest themselves. Without universal screening, 99% of infants with CCMV will go undiagnosed, and they will miss the optimal treatment window. That treatment may have prevented further progression, lessened the severity, or even reversed the course of some of the symptoms of the disease. These babies will never have that opportunity, given that they were not identified as having CCMV in the first place. As an audiologist, I'm particularly concerned with the risk of hearing loss for children with CCMV. Nearly every baby born in the state of Michigan receives a hearing screen at birth, which has greatly improved the age of hearing loss identification and treatment, as well as speech and language outcomes for children that fail on their newborn hearing screening. However, children with CCMV may actually pass that newborn hearing screening only to develop hearing loss later in childhood. HB 4402 would allow us to identify these children at risk and give us an opportunity to monitor them for the onset of hearing loss and treat it immediately if it develops. In my work, I see the devastating impacts of untreated hearing loss, particularly in the critical period of language acquisition from birth to 3 years of age. It is well established that early identification and treatment of hearing loss lead to better outcomes for children when measured in terms of vocabulary, general language abilities, speech intelligibility, social emotional development, parental bonding, and parental grief resolution. Hearing loss is a neurodevelopmental emergency. If unidentified and untreated, the consequences can be irreversible, limit language development, cause social isolation, and limit educational and economic opportunities throughout a lifetime. Minnesota became the first state to enact universal CCMV screening in 2021, followed by Connecticut beginning earlier this year. Many other states have adopted targeted screening legislation or are considering the same. The Michigan Audiology Coalition asked Michigan to become the next state to universally screen all infants born here to identify each and every baby at risk. Universal screening is safe, it is non-invasive, and it is cost-effective. It will allow children with CCMV to be identified, treated, and monitored for hearing loss, along with other associated, potentially lifelong and devastating symptoms of this disease. Please support HB 4402 to allow us to identify the children at risk, provide evidence-based treatment during the optimum time frame, and empower their families and healthcare providers to provide the care and treatment needed to give them the best possible outcomes as these infants start their life. Thank you for your time. Happy to answer any questions.
Thank you, Doctor. I'm going to turn it back over to Representative Bonak since he had a question, and maybe potentially you can answer that for us.
I did read the bill analysis finally, and I saw that there's, I believe, 19 states that screen right now.
And yes, there's two types of screening. There's universal screening, and then there's targeted screening. So universal screening is what we're proposing here in Michigan, and that's what Minnesota and Connecticut are doing. The other states are doing targeted screens. So individuals that fail their newborn hearing screening will then be screened for CCMV. The problem is that misses all of those infants that pass the newborn hearing screening only to develop the symptoms later in life.
Can I ask a follow-up?
Follow-up.
What is the treatment for CMV?
It's typically an antiviral regimen that's, again, most effective in the first month of life. I believe you're going to hear testimony from a developmental pediatrician next who can talk best about treatment.
Thank you.
Representative Meerman.
Thank you, Chair. Sounds like many of us have it today, and a third of the kids will have it by age 5. I guess you're talking about knowing that they have it, but it also sounds like there isn't much treatment. But talk to me about treatment, I guess.
So the treatment, again, it's antiviral drugs that are provided to the babies. Again, babies born with CMV, so that congenital CMV, rather than somebody who's acquiring it after they're born or in adulthood. Those individuals, the symptoms are going to be much more benign. It's when mothers become infected with it during pregnancy. The treatment is provided after the baby's born during their first month of life.
And so antiviral, if the tests show they have it, then you're saying they would get the antiviral even before they might show hearing loss.
Correct. The current literature is exploring this a lot. It's been tricky to do research simply because we haven't known who these babies are, who's got CMV. But as we now are screening, and some of these states are doing it, the data are showing that treating babies that appear asymptomatic is potentially reversing course or offsetting the severity of the symptoms.
And then the antiviral is just kind of combating, because there isn't a vaccine, there's no
vaccine
treatment
for it. It is so it treats the virus and prevents it from duplication. Yes.
Thank you.
Thank you, Representative. Representative DeBoer.
So the pregnant woman has this exact virus or has a herpes complex? Or
So the pregnant woman would acquire it through the same way you get a cold, droplets of some virus that they acquire. They become infected with it. Oftentimes the woman that's pregnant may have pretty benign symptoms. They're most devastating to the baby.
so a lot of people have this in their bloodstream and don't know it.
Correct.
But in 21, Minnesota decided to test for it. Someone discovered it.
Well, it's more so not looking at the adults, it's looking at the babies. So because when the baby's born, if we test a sample within the first 21 days of life and we figure out that the child has congenital CMV, that's the kind we're concerned about.
Okay, so there's different varieties.
Yep, so regular CMV, congenital CMV. So that's the baby that acquired it from mom while mom was expecting.
Yeah, well, great. Thank you.
You're welcome.
Thank you, Representative. Representative Schmaltz.
Thank you for your testimony. You did answer one question about how you get infected through droplets and that. Are you seeing a lot of increasing cases of this, or is it staying the same? Is it?
It's an interesting question, simply because if we're not screening universally, hard to kind of track data over time, and we're making educated guesses at the prevalence of this.
Okay, thank you.
Mm-hmm.
Thank you, Representative. Any other questions from the committee? Seeing none, thank you very much for being here. And again, I apologize for my blunder, so
Not to worry. Thank you for your time.
you bet you. Next, wishing to speak in support, Kim Williams.
Good morning. My name is Kim Williams. I'm the parent of a child who was born with.
If you could put your button on for us, please. Thank you.
Sorry. Good morning. My name is Kim Williams. I am the parent of a child born with congenital CMV. I'd like to thank all of you for the opportunity to speak today about Bill 4402. My son Joe appeared healthy at birth, other than failing his newborn hearing screening. Luckily, he was born at a hospital that had a protocol that dictated CMV testing be performed based on those failed screenings. That resulted in early diagnosis for Joe. Unfortunately, that's not the standard across our state, and if he was born at another hospital, he may have never been tested for CMV. That early diagnosis is what allowed us to begin treatment of antivirals within the optimal window of 1 month from birth and connect with specialized doctors and early intervention services promptly, which significantly improved Joe's chance for success. Most babies with CMV show no symptoms at birth, and even those that do aren't consistently tested for CMV. Without universal newborn screening, many cases go undiagnosed until later, if at all, leading to those children missing the critical window for effective intervention. Congenital CMV is the most common infectious cause of birth defects in the US, yet most parents have never heard of it, like me and my husband. House Bill 4402 would ensure better education for parents and all Michigan newborns being screened, and therefore provided the chance for early detection and intervention opportunities like my son Joe was. On behalf of my child and countless others like him and our family, I urge you to support House Bill 4402. I'm happy to answer any questions about our specific experience and the impact that congenital CMV has had on my son Joe. Thank you.
Committee. Any questions? Representative DeBoer.
So you had no idea you had CMV when you were pregnant?
Correct.
And so were you tested then after that to see if you had it, or they just assume you must have had it and it wasn't congenital, or?
Right. A lot of parents like myself, their baby that's born with congenital CMV, they probably have a toddler. It's very rampant in childcare settings like that, as you can imagine, a lot of viruses. So the assumption is that I had never had it before, and I probably caught it from my toddler when I was pregnant with my second child, and unknowingly was sick, minor symptoms, never knew. Until he was screened. And so I'm actually pregnant with our third right now. And because I am aware of CMV now, have been able to be proactive and get CMV testing and monitor this pregnancy closely to make sure, although the risk is extremely low to pass it on in a future pregnancy, at least now we know and can monitor for it.
Congratulations.
Thank you.
Yeah, thank you.
Thank you, Representative. Representative Meerman.
Thank you. The treatment then was antiviral for your child?
Yes, he was referred to infectious disease right after birth based on his positive CMV, and so we were able to start antivirals. He actually failed in each ear once, so it wasn't consistent. Thankfully, they still screened for CMV. So he started antivirals, and his hearing loss did progress. But we were able to catch it. He was able to get a cochlear implant at 1 year old and now has bilateral hearing since we were able to detect that. Since he only had unilateral or one-sided hearing loss, we probably would never have known that he couldn't hear because he does respond with the one ear. So it was, really beneficial for us that we were able to detect it because of that screen.
And the antiviral might have prevented something worse?
Right. Hearing loss can progress, so he could have ended up losing hearing in both ears had we not done the antiviral. Obviously, we can't know for certain, but it does, like I said, based on the literature so far, show that it can help prevent future hearing loss progressing further.
Thank you. Any other questions? Seeing no other questions, thank you for being here today. Appreciate it very much.
Thank you so much, everyone.
Next up, wishing to speak in support, Dr. Megan Pesch. University of Michigan. Good morning.
Good morning. Mic okay? Yeah? Okay. Thank you for having me today. My printer didn't work this morning, so I'm reading off my phone. Sometimes I think that's the hardest part of my day, is printing. So good morning, Chair and board members. My name is Dr. Megan Pesch. I'm a developmental and behavioral pediatrician at the University of Michigan. I am also the executive director of the National CMV Foundation, and most importantly, I'm the mom of a 7-year-old with congenital CMV. So we've heard a little bit about CMV being very prevalent. I'd like to just go over what it is. Sometimes we use the short term CMV, and that's the name of the actual virus. When a person who's already been born catches it, it's just a cold or even no symptoms at all. But if a pregnant person catches it and then it transmits through the placenta to that growing baby, that baby is born with congenital CMV. CMV, the actual virus, unfortunately, loves fetal brain cells. It loves fetal ears and can do some massive damage. It is a cause of stillbirth, miscarriage, and of course, we've heard about the developmental disabilities. Unfortunately, most people have never heard of it, yet it's very common. So 1 in 200 babies, 1 in 150 babies, depends where you live in the state or where you live in the country, but super common. More common than Down syndrome, more common than fetal alcohol syndrome. But, why aren't we talking about this? I learned about CMV in medical school. I learned about it a little bit in residency, but just the bare minimum. No one ever told me how to reduce my risk in pregnancy. So CMV, as many viruses are, rampant in daycare. My daughters, I had 2 in daycare at the time, my older girls, likely brought it home. And because I was a very hands-on mom, sharing food with them, or I'd make dinner and they wouldn't eat it, and I'm like, well, I'm hungry and pregnant, so, more for me, great. I likely got some of their saliva in my mouth, and that caused the virus to impact my pregnancy with my 3rd daughter. Her name's Odessa. If anyone had told me, if my OB had told me or known to tell me, even in medical school or any of my training, that I should not be sharing food with my toddlers in pregnancy, avoid kissing them on the lips, give them a cheek instead, things like that, then, I would have been empowered to at least make some more informed decisions. And who knows, maybe I wouldn't have. Maybe I would have said, that's a choice I want to make for me and take the risk, but I didn't have that choice. I feel like, honestly, if I didn't know, who is going to know about this if we don't do something from a public health standpoint? When my daughter was born, she was perfect, and she still is perfect, but she did fail her newborn hearing screen. Often newborn hearing screenings are failed because of fluid in the ears, so I told many anxious moms, don't worry, it's going to be fine. So I took this baby home from the hospital, and I was determined not to be the anxious mom. Well, I wish I would have been. I was staring at this baby for 3 months before we found out that she was profoundly deaf in both ears. And I was the one that asked about the CMV testing, not because I had some special instinct. I asked about a whole, host of things. And one of the best doctors in the state, I would argue, at U of M told me, no, this baby can't have CMV because she looks too good. And this is the fallacy. I was taught in medical school that these babies look sick. My daughter was perfect. She was 8.5 pounds. She was very healthy, except she wasn't. When I tested her urine, she had millions of copies of this virus in her urine, and later we found out that the virus was in her brain too. Unfortunately, my family's story is not unique other than, having a pediatrician mom to kind of figure this out. So every year in Michigan, we've got about 500 babies born with this condition. And now in my clinical practice, I see some of these kids who are lucky enough to get diagnosed. I think we're probably diagnosing maybe 20. So we're missing so many. My daughter lost the chance for antiviral treatment early on, and by the time we tested her hearing, she had lost it all. She had some hearing at birth. She's startled. She had noisy sisters. One of them's here today. And my daughter definitely had some hearing at birth. But at 3 months, when we figured this all out, we saw that she had brain damage. She had no more hearing left. And today, she's profoundly deaf. She has cochlear implants, but they don't work so well because her brain has been impacted. She uses ASL to communicate. She's autistic. And these are some of my favorite parts about her. She's a gem. I always say she looks bad on paper, but in person, she's fantastic. But we lost so many chances to intervene. Michigan has the opportunity to be a leader here, like other states. Utah, Texas, Georgia, Florida, Louisiana are all testing babies to some degree. And Minnesota, Connecticut, like we heard, are testing all the babies, which is the right thing to do. So I urge you to support this legislation to require universal congenital CMV screening for all the babies, to provide education to families so they can make informed decisions about their behaviors during pregnancy, and then ensure that all the babies who are tested positive get the follow-up that they need. Every month that we wait, dozens of babies in Michigan are losing the chance to be diagnosed, are literally losing their hearing. And universal screening would give families the knowledge and opportunities they deserve to really make sure their children have the best outcome. Thank you for your time, and I'm happy to answer any questions.
Thank you so much.
Thank you.
Representative Prestin.
Thank you, Chair. Thank you for your testimony today. My question is just regarding, the always trying to do no harm. The prevailing treatment on symptomatic versus asymptomatics in this population, weighing the risks that are associated with antivirals in that population. What is the prevailing protocol?
Absolutely. So now antiviral medications are recommended for infants who have hearing loss and infants who have other symptoms going on. Brain issues, sometimes this can drop platelets, so they're at high risk of bleeding, things like that. So the babies who have issues, and we often have to do studies to learn about these issues, so those babies are eligible for antivirals. The babies who have really mild infections, the ones that are, say, infected late third trimester, we generally don't offer antivirals because there's always risks with any medication. It's an oral medication, so you take it twice a day, but it's a 6-month course for the sickest babies, 6 weeks for the babies who only have hearing loss. And it's always just a discussion we have with families. Not all families are, excited to do a medication in their baby that otherwise looks perfect. And I strongly feel that families need to be informed. So there's the medication, but also the monitoring for the hearing loss. In Michigan, we keep our dried blood spots. So kids in Michigan who I see in clinics, sometimes they'll come to me and they're 8 years old and the family just realized they're deaf in one ear. In Michigan, unlike other states, we can go back and test the dried blood spot, the newborn testing heel poke that was done at birth, and find out, CMV is still there on that blood spot from 24 hours of life. And those kids, we have no idea how long they've been deaf in that ear, and that hearing might not be recoverable. So some of this proactive monitoring, which any kid with CMV is eligible for, I feel like is included in the definition of treatment. Yeah, of course.
Representative Thompson.
Thank you, Mr. Chair. Thank you for your testimony. 2 quick questions. First one, can you explain a little bit about what the virus does to those tiny developing structures in the infant's ears?
Yeah, absolutely. So in the brain, it's kind of horrific. It goes into the fetal brain cells, and it integrates into the DNA. It can cause those cells to stop developing. It can cause those cells to destruct. Some of the little tiny, early on in the embryo, when those tiny first brain structures are being developed, I kind of think of it as like a tree, like the brain growing, first you get the stump and then all the different branches of the brain. it can cause structures in the brain not to develop or not to migrate into the right place. So you think if you've got a sapling, if you cut off a branch, it's not going to grow into the beautiful oak that it should. It'll grow into a different shaped tree. So if you'll pardon my analogy, it can do some really serious damage. In my daughter, we could tell that it increased the it inflamed the blood vessels in her brain. It destroyed some of the cells, so we could see calcium deposits from where her immune system was trying to fight back. So there's a large variety, and thankfully, it's only about 10% of kids who have issues with the brain, but a lot of them you just can't know.
Thank you. That was very informative. And then second question, please.
Sure.
Are we doing any type of titer testing in pregnant women to see if they're immune to this virus and if they've had it or not?
Yeah, I love this question. I will try to not get on my soapbox because, so in Michigan and generally in the U.S., we are not. In Canada, yes. In Europe, yes. And I think it's because they're hard to interpret, and you're never truly immune to the virus. So similar to COVID, the first time you get it, it can hit you the hardest. And if a pregnant person gets it for the first time, it can hit that baby the hardest. But you can still get, like COVID, another strain. So you're never truly immune, although like COVID, when you get the second strain, it's usually doesn't hit you as hard, and the impact on the, excuse me, on the baby isn't as hard because mom's got some antibodies circulating. So if women request this, they can be tested for it for sure and monitored closely. That's what they do in France. That's what they do in Canada, especially women who are working with young kids. I mean, I was a pediatrician, like at home with 2 toddlers. Like, there were toddler fluids all over the place in my life, who was at higher risk. And so, there can be some discussion with OBs, but it's not a standard protocol, unfortunately.
All right. Thank you. Thank you very much.
Representative Whitwer.
Hi, thanks for being here. Within DHHS, there's a newborn screening committee that evaluates proposed screenings. Has this committee reviewed this bill, given consideration to adding it, and do they have additional funding in order to be able to do that?
I can't comment on the funding. I know they have considered it. They have given us some feedback and ways in which Michigan can become more ready to support. We are talking about 500 babies a year, which is a lot in terms of newborn screening numbers, which personally is a reason not to do it, but it does speak to, maybe some of the challenges in getting up and ready. Yesterday, I flew back from the International CMV Conference, and I was thrilled to see our Michigan newborn screening team from DHHS there, learning more about congenital CMV. So they have been great partners, but also, careful not to comment in a partisan way at all on the bill. But they've looked into how to operationalize it, identified challenges, but I think they aren't anything that we could meet.
Thank you.
Couldn't meet.
Representative DeBoer.
So in your testimony, you said you made an uninformed choice. So part of what you're saying for treatment of babies would also involve the doctors, the gynecologists, to tell the women what to watch out for as they have other children in the home, and I guess the other fellow pediatricians as they have children everywhere.
Right.
Yeah.
Yeah, exactly. I was told not to scoop the kitty litter, so I decided I didn't. We had 2 cats. I didn't do that. I didn't eat sushi or lunch meat. There are some simple behavioral things and some of my friends in their pregnancy, they were like, I want that sandwich, and you do you. So I think it's good to have the knowledge, because I just didn't. I was one of those crunchy moms in the first trimester. I'm washing my hair with baking soda. I did all the things. And if I would have known, I'd like to think I would have made some different choices.
Yeah. Well, you cannot live that way, though. And,
no.
Yeah.
And this kid looks bad on paper, but she is perfect. She is a delight. And, along with her sisters, the light of her father in my lives.
Yeah, it's like every human being, we make the best choices we can at the time, right?
Absolutely.
Yeah.
Absolutely.
Thank you for your blessing of your testimony.
Thank you.
Thank you. Any other questions, committee? Representative Meerman.
Just quick, I think the effectiveness of antiviral,
Yeah.
how effective that is in an overall sense.
Absolutely. It's not a magic bullet at all. It does decrease, so it decreases the risk of hearing loss. It sometimes in kids, we think it postpones the hearing loss. So say, for instance, a child was born with a mild to moderate loss and had a hearing aid. They may, even with antivirals, eventually end up with a cochlear implant. But as a developmentalist, if you can get natural sound into that developing brain, even for an extra 6 months, 2 years before they completely go deaf, the results or the impact of a cochlear implant are so much better in terms of language outcomes. So my daughter had 0 hearing by 3 months, and she's never developed speech, even though we did all of the things with the cochlear implants and all of that. And, you can't play like would have, could have, but kids who have some hearing, natural hearing, because cochlear implants aren't like this great fix, but if you get sound through hearing aids even for longer time, their ability for spoken language is better. Other things that we're studying now, autism goes hand in hand with CMV. What we don't know, but we're looking at, is if you treat with antivirals, you're decreasing all that inflammation in the brain, and could that possibly, and we don't know, but I'm hopeful that, could we reduce the risk of autism in these kids too? So the research really started with the hearing loss, but now it's expanding, and it's pretty exciting.
Thank you. Seeing no other questions, thank you very much for
you, everyone.
being here today. We appreciate your time.
Thanks.
All right, moving on. Next, we will be hearing testimony on House Bill 4107, 4108, and 4847, introduced by our very own Representative Prestin, Frisbie, and Harris. If you could make your way up to the testimony table when you gentlemen are ready, the floor is yours.
Thank you, Mr. Chair, members of the committee. Just so you know, the EMS, fire, and police jokes are all rampant right now, and they just informed me they surrounded me. So I'll expect your wielding of the gavel to be critical in my safety. Okay. Again, thank you to the members of the committee for taking the time to hear about this life-saving bill package. This legislation deals with the Stop the Bleed initiative. The goal here is straightforward, but critical, and that's to give our students, or anyone in our communities really, the knowledge and techniques to save a life in an emergency. As way of background, I served 26 years in law enforcement, and prior to that, I was an emergency medical technician, not a paramedic like my colleagues next to me. I also work closely with our schools, providing departmental training, assisting with active shooter preparedness, and teaching other life-saving skills to the staff. Over the course of my career, I've responded to countless emergencies, car crashes, industrial accidents, attempted murders, even a homeowner who suffered a chainsaw injury. In many of those cases, the difference between life and death came down to whether or not a bystander had the tools and the knowledge to provide immediate care before the first responders arrived. That's why this legislation is so important. Back in 2016, the legislature took a big step by requiring CPR and AED training in our schools. House Bill 4107 builds on that by adding Stop the Bleed education so that our secondary students can learn bleeding control techniques right alongside their CPR and AED training. This is not about turning students into medics, although I think recruitment-wise we could use that right now. But it's about empowering them with simple, proven skills that can save a life until a professional gets on scene. And we know this works. 14 states have already decided to provide some form of Stop the Bleed training for students or school staff, and Michigan should join them, so that our students are not left behind when it comes to these life-saving lessons. We've worked with educational stakeholders, and the intent is not to burden schools with costly requirements for equipment or supplies. Instead, this bill will strongly encourage schools to do the hands-on portion of this training as part of their health and safety curriculum, just as they've done with the CPR and AED training. This bill also encourages partnerships with trained first responders or other Stop the Bleed instructors as local resources for the program. At the end of the day, this bill is about making sure that if tragedy strikes, whether in a school, a sports field, or in a community setting, our young people have the knowledge to act. And seconds matter in those situations, and Stop the Bleed training can mean the difference between losing a life and saving one. So with that, I'll turn that over to my colleagues.
Go ahead.
Thank you, everybody. My bill 4847 would change the Good Samaritan law to remove the threat of being sued for acting in good faith. And Dave and I have been in EMS longer than we care to mention, but we've seen people saved by first responders before first responders arrived by the general public just by stopping a bleed. A person can die within 3 to 4 minutes or less, depending on which artery may be affected, and losing their entire blood supply. So the first person to act often is the first person that, or the person who watched the incident, or the first person to discover somebody. And that quick action can mean the difference between life and death. And what this bill would do is put the actions of Stop the Bleed into the Good Samaritan law and remove that threat. While the threat is small, it's still there, and it does prevent people from taking action. So if, $50 and a pen, anybody can sue anybody, but if you tried to sue somebody for trying to stop you from bleeding to death, this bill would change the fact that it would be tossed in a hurry. So I encourage you to support this bill and make everybody a first responder when they can. Thank you.
Thank you, Jared. Thank you, members of the committee. They took almost everything I had written down to say. So
I told you to go.
I'll just abbreviate it by saying, as a currently licensed paramedic, I've responded to countless situations, especially in the very rural setting that I live in, where bleeding was the issue when I arrived on scene. In my neck of the woods, a lot of people know how to respond to bleeding emergencies, but when you don't, seconds do matter. Response time's up by me, 30 minutes to 45 minutes. If we don't gain control of an uncontrollable hemorrhage, that person will not survive. Empowering the public with this type of knowledge and giving them the protection and the expansion of the Good Samaritan Act is critical, because EMS and first response does not work without an engaged populace taking the training that they can and being a part of the system. From AEDs to opioid antagonists, the Good Samaritan expansion has saved countless lives. This is another great expansion, a necessary one. There will be more to come. I believe that EMS and empowering the public needs to continue this expansion for other life-saving measures down the road, and I strongly encourage your support of this bill package. Thank you.
If I could just add one thing. 911 telecommunicators have been teaching people how to stop the bleed for probably 30 to 40 years now. And when given the opportunity, most callers will take that opportunity. But even those lost seconds or minutes in a 911 call, if they stop the bleed first, is a much better situation for the patient, so they don't develop shock. And once they develop shock from blood loss, your chances of survival start to plummet by the minute. So thank you.
Thank you.
And we're joined today by Laura Walker and Dana Lockwood from Stop the Bleed Coalition.
Yep, thank you, Representative. We do have a couple questions. Representative Thompson.
Thank you, Mr. Chair. Gentlemen, thank you so much. Obviously, it's great working with other medical professionals here in Lansing, and I really respect the fact that there's so much that we can work on in Lansing, but that you guys are focused on what brought you here and your backgrounds in policing and in EMS and being first responders. And as a nurse, same situation when it comes to the Good Samaritan law. You see something happen and your instinct is to go and help, but then you pause for a second because you think, am I going to get sued if something goes wrong when I tried to help? What other things does that Good Samaritan law, what have we changed in Michigan? Have we changed that when it comes to giving CPR or anything else?
Yep, CPR is covered. The use of an AED, the public access defibrillation, has been around for almost 15, 18 years now, probably. And any acts in good faith, this just specifically says if you try to stop the bleed as a citizen, that you're going to be protected.
Oh, I love it. Thank you guys so much. for this
Specifically,
legislation.
CPR was 86, AEDs were in 99, and opioid antagonists were 2016.
So we need to technically, specifically, are we really going to, does it really have to get that deep? I mean, I know, like you say, everyone's hot and heavy to sue.
Specific
but now you're
inter-
adding stop the bleed.
Yeah, specific
what it-
interventions I think are important
Okay,
because
to
if,
be put in
you
there.
know, if someone wanders too far outside of the scope and causes harm, you know, the first thing is do no harm. So, you know, you definitely want to, you know, be aggressive with these, but be prudent and judicious at the same time when you're, you know, entering more into the aspect of Good Samaritan.
And the other thing would be the teaching of the youth in Stop the Bleed. What are those things that a young person can learn for life skills that they can take immediate action to try to save somebody's life?
Agreed. Again, thank you guys. This is fabulous.
Thank you. Next up, we have Laura Walker on Zoom wishing to speak.
Good morning. Thank you for having me. My name is Laura Walker. I am a nurse and an EMS provider with over 30 years experience in critical care, emergency medicine, and flight. So I'm seeing a theme this morning. But I'd like to thank the chair for having us today, Chair VanderWall, and members of the committee for the opportunity to speak in front of you on House Bill number 4107, 4108, and 4847. As you've heard, Stop the Bleed is a national initiative that teaches absolutely everybody what to do and how to control bleeding in the event of an emergency. That means the injury alongside of the road as you travel home. It is at your place of employment, at your school, your church, or in your very own home. Learning these 3 simple measures of holding pressure, packing a wound, or applying a tourniquet could actually save someone's life. The skill can be learned in less than an hour by any person. As a healthcare provider for over 30 years, I think it's important that every person, no matter the age, is given the opportunity to learn this skill. Teaching this skill in communities, in schools, empowers all ages with the skill that they can utilize for a lifetime. As we promote and teach Stop the Bleed out in the community, we must add a layer of protection for our community members that perform basic first aid to save someone's life by amending the Good Samaritan law to cover basic bleeding control. Currently, bleeding control is not covered under our Good Samaritan law in the state of Michigan. As I go out into the community and teach this class, people are very excited about learning the skill, but towards the end of the class, they will always ask, am I covered under the Good Samaritan law? And that's where we kind of have to pause and answer truthfully and say, no, but. And when you do that, you see that hesitation in people. When it's a matter of life and death, there is no time for hesitation. Our ask is that Michigan become a leader in bleeding control by teaching our students and community members and by amending our Good Samaritan law to cover bleeding control. Because at the end of the day, the only thing more tragic than a death is a death that could have been prevented. If you have any questions, I'm happy to answer them. Thank you for your time and your efforts today.
Any questions by the committee? Seeing none, thank you very much. We appreciate it. Okay. Next up, wishing to speak and support, we have Dana Lockwood on Zoom. There you are. Floor is yours.
Thank you for asking me to be a part of this. My husband and I had a personal experience with this a little over a year ago, and we live a long ways out in the country. And I'm a high school teacher that was fortunate enough to have Stop the Bleed in one of our professional development days. And because of an open heart surgery earlier in his life, he was on blood thinners, and my principal gave me a Stop the Bleed kit, and we just always had it just hanging around the door. But we live way out in the country, and he was on the other side of the pond, and he kind of went to lift a tree and slide it over to try to drop it. It was a relatively small tree, but down at the bottom there were some open branches, and as he fell, those open branches it was just like a knife. I was standing right beside him when it happened, and it opened his leg up about 7 inches. And I was like, I'm running around this pond that we have, and I'm calling 911, and I'm thinking, okay, I know right where that Stop the Bleed kit is, but like in my mind, when a trauma like that happens, it's like, oh my God, like, above or below, like where do I put that thing? And so as I'm coming back around the corner, he's holding his leg together. He had, applied pressure, and we were trying to get it under control, and I'm trying to turn that tourniquet. And we have a lot of neighbors, but they're far apart. And I reached out through his cell phone because I was on 911 with the operator, and I couldn't be released from that call. She kept saying, "You're doing fine, you're doing fine." I'm thinking, I'm not doing fine. And I reached into his pocket, and I called a neighbor, and I said, "I need help." And this guy across the way came running over, and he whipped his belt off of his pants, and he started a second tourniquet. And it took a long time for the ambulance to get here because we're so far out. And he was bleeding to death. And like we both talked about it afterwards, it was like, which one of us was going to pass out first? I mean, it was horrible. I just can't believe that we had the tourniquet. On the way back, I was thinking, oh my God, I hope I know right where that is. I think it's right by the door, but I'm telling you, like, I never thought I'd ever have to use a tourniquet, ever. And I'm sure the neighbor across the way, like, had he not done that, when we got to the hospital, I was begging them to take us to a hospital that's connected with U of M because of the heart surgery that he had had. And they're like, he's not going to make it. He's not going to make it. And I mean, I was driving crazy to get to the hospital, and a chaplain met me at the door. I thought he didn't make it. So I think that anything that you can do to help create, to stop these barriers from people helping, had that neighbor not helped, he might have died. I went back to my classroom the next day, and it's a pretty small school setting, and I told every kid about it. I told them what happened. I told them, hey, think about this. Like, think about what could we use as a tourniquet to save a life. And it was about an opening of about 7 or 8 inches that got infected. We had to see a wound specialist for a month after that, every week for a month. But I'm telling you, if there's anything that I can do or anybody else can do, I never in my wildest dreams thought that I would have used a tourniquet. I wasn't even sure if I was doing it right, but I know that I saved his life. I know that. And I've been gifting, I told Laura this earlier, I've been gifting tourniquets out to people and giving them a quick demonstration. I'm not trained, but he would have died. 100% he would have died. So please help us in making a Good Samaritan law apply to this, so that the neighbor doesn't hesitate, or the person on the highway doesn't hesitate, or the person in the classroom. Because of our situation, every classroom has a Stop the Bleed kit now in it. So
thank you.
I'll be happy to answer any questions that you have, but
thank you very much.
Thanks again for having me.
Thank you very much. Appreciate you being here. Any questions from the committee? Seeing no questions, I want to say thank you again for sharing your story. Thank you for being here and urging us along on this great legislation. Thank you.
You're welcome.
We have a couple cards to read in support of the bills. Not wishing to speak, Taylor Elpert, Michigan Health and Hospital Association. Not wishing to speak in support of the bills, Michigan Traumatic Coalition. Thank you. Next up for testimony today, we have 4841 introduced by Representative Rigas Representative, when you are ready, if you could push the button, the testimony table is yours, and we look forward to your testimony today. Thank you for being here.
Thank you. Thank you, Mr. Chair. Thank you, colleagues and committee, for allowing me the privilege of speaking on this bill, which we've been working on for quite some time. And this bill was birthed from two personal experience that I had had. In 2004, I suffered a miscarriage at 12 weeks. I had gone into the hospital to get the procedure done, which is called a DNC, to clear the deceased fetal remains from my uterus, and I had requested to receive those remains. That is my son or my daughter, and in order to grieve properly, I had wished to have a service. And I was told by the hospital staff and administrators that this child was medical waste and would be incinerated. And I had no recourse. I was already grieving. I was already in a very bad place, and there was nothing that I could do. I had to accept that, even though that was against my wishes. And then in 2012, I once again had another miscarriage. It was a standard doctor's appointment, and they had found that the baby had passed away in the womb. So at this time, I elected to have this miscarriage at home. So it would be my choice. And unfortunately, a couple days later, the miscarriage had started, and it's something I could not have anticipated how painful emotionally and physically that was to go through. However, after the process, I had scheduled a doctor's appointment for a couple days later just to get checked out. But in between that time period, I had developed an infection from the miscarriage. And I once again had to go into the doctor's office, and they scheduled me for another DNC surgical procedure because there were, the infant was still intact in the womb, and I had passed everything else. And I don't mean to be graphic, but I'm just being transparent and I'm being honest. I want you to get the picture of exactly what I went through so you can understand why this legislation is important to me, not only me, but to other parents in the state of Michigan. So after that procedure, the infection worsened, and I ended up in a septic state. I had been sedated for, and I don't even remember how many days. It was 7 or 9 days I was sedated. So I do remember hearing the doctors asking my husband what my wishes were, like I was not going to make it. And I made that choice because I did not believe that my baby was medical waste and should have been disposed of in the garbage. That was against my deeply held beliefs as a Christian and as a parent. So for the hospital to tell me that it's hospital policy that a fetus prior to 20 weeks is garbage is unacceptable. And then when I got elected to the legislature, this was one of my priorities. And then to learn that there's actually Michigan statute that states that they are supposed to offer those remains infuriated me, because this did not need to happen. And in 2010, at 28 weeks, I had a stillborn son, but he was over the 20 weeks, so it was a normal death, if you will. He did not go to the morgue. I requested that he remain in the nursery until the funeral home would pick him up, and we had that funeral. And the healing for that, because we were able to have that service, was so much healthier than going home with nothing. So yes, it's currently in law. I'm sorry. It's currently in law that they are supposed to offer these remains to a funeral home or any other entity that's licensed under Michigan Health to pick up those remains, whether you prefer cremation or a service. But this puts teeth in it, because not all hospitals are following it. And I know one of my colleagues, his wife had several miscarriages, and every time they had a miscarriage, they were offered those remains. So are we supposed to hospital shop in these life-threatening situations? So first violation is a civil infraction with a maximum civil fine of up to $10,000. Any second and subsequent violation is a misdemeanor punishable by imprisonment up to 90 days and a fine of $50,000. And some may argue that is too high, but how much is that worth to you? How much is your lost infant worth to you? You can't put a price on that. And having these stiffer punishments and fines and penalties will deter these hospitals from robbing other parents of their rights as I was robbed. So thank you. I can take any questions.
Thank you, Representative. Questions from the committee? I'm sorry, Representative Smaltz.
Thank you so much for bringing this forward, and I'm sorry for everything that you've gone through. That's a lot to go through, physically and mentally, but I think this is very important legislation, and it means so much to women who have gone through miscarriages. So thank you again for coming forward.
Thank you. If we can help, that's what I'm apparently here for.
Representative Thompson.
Thank you, Mr. Chair. Thank you, Representative Rigas. I think that our role in the legislation is ultimately advocating as well. And a lot of times people don't know what their rights are until they're read those rights or understand them. And too many times in healthcare, I've seen across the board as a nurse that, especially young women, we just do what we're told. And we don't ask questions, or we don't ask why, or we don't know the legislation behind it. So for you to do this is absolutely amazing. Shows how strong you are, and thank you so much for bringing this about.
Thank you.
Thank you, Representative. I do appreciate you sharing your story, as emotional as that can be, and continues to bring back those memories. We can't move forward without those things. So thank you very much for your time today, and we look forward to working with you on this bill.
Thank you very much, committee. I appreciate it.
We do have a couple cards to read in support of the bill. Not wishing to speak, Jeff Hewson, Michigan Family and Forum. Not wishing to speak in support of the bill, Catherine Bassard, Salt and Light Global. Not wishing to speak in support, Genevieve Marion with Right to Life. Representative Whitwer moves to excuse absent members. There being no objection, the motion prevails. However, before we leave, it is a special day, as I started out the committee and forgot that she was testifying in another. It is Representative Carter's birthday today, and our dubious clerk with the talent she said is going to lead us off. If the committee and the audience would join us in as we sing happy birthday to Representative Carter. Happy birthday to you. Happy birthday to you. Happy birthday, dear Representative Carter. Happy birthday to you. Congratulations, Representative. We won't put you through the spanking machine or sing the "How Old Are You" piece, but congratulations on your day today. There being no further business before the committee will stand adjourned.